Okay. This is the anatomical position of the bone. Okay. Clear? Shiva, please, short. Head. Here is the neck. Here is the greater trochanter, lesser trochanter. This all is upper end. This is shaft. This is lower end. Okay. Upper end again. The upper end is made up of this head, then neck, then greater trochanter, lesser trochanter. On the front, there is nothing like very appreciating. So this is line. We say this as line. In the original bone, you will find some line. On the back, you will find this very strong structure, crest. So intertrochanteric crest. Feel here. Intertrochanteric crest. Okay. Head. The smooth surface is covered with hyaline cartilage. Here, fovea. Fovea. Ligamentum teres. How it is attached. Here is the ligament coming out of it, like this. It's a curved structure. Here is the acetabulum. And you know it is covered with labrum and all. The ligament will come here and attach here to this notchy area, like this. If there is dislocation, there is a chance of rupture of this ligament, and this can even lead to some degree of ischemic necrosis. If this system is good, ischemic necrosis can be prevented. But if the retinicular vessels, they are even damaged, ischemic necrosis may take place. It takes some time, not just acutely. Then is the neck. Neck has upper end, lower end, anterior surface, posterior surface. Khalas. Greater trochanter. Majid, please out. This is greater trochanter. This is the superior or upper border of trochanter, and you can find the apex, the elevated part. You can find the fossa, trochanteric fossa. You can find the trochanteric fossa. Clear? Lesser trochanter with intertrochanteric crest and conical shape. Here is quadrate tubercle. Quadrate tubercle. Quadratus femoris. Then the posterior border, linea aspera. Here, anterior surface, posterior surface with head, medial surface, lateral surface. Here, same anterior surface, only posterior is now called popliteal. And here, medial surface, here, lateral surface. Two condyles. The medial condyle with the head is bigger, hanging more down. This is the lateral condyle, small. But the angle is like this, so it is, yes, on the same line, so it is more weight transmission than the medial one. I told you a groove. Okay, this is a condyle, here is the epicondyle. Condyle, epicondyle. Here is the groove. On the lateral. On the medial, there is a condyle, epicondyle, and then there is a tubercle here, adductor tubercle. Clear, bone? Yes. Let us do the muscles. This is on the other side, remember. So, here is the pectineus. These blue are insertions of it. Shiva, please. Pectineus. This is psoas. Sometimes another downward here, iliacus. So, iliopsoas. Remember, the iliacus is giving you fascia for the sheath, okay? Yes. And the other fascia is white transversalis. The psoas does not have any contribution in the sheath of formation of, remember this. Pectineus. Then there are adductors. Adductor, this is longus. This is brevis. Pectineus, adductor longus, brevis. Then this long line, adductor magnus, even has two attachments continued here. So adductor magnus, yes, here and here adductor magnus. The same muscle inserted in two areas. Gluteus maximus. You remember the gluteus maximus is inserted at three places. One is this. The other is on the greater trochanter. And the third few fibers are inserted into the iliotibial tract. You remember I told you iliotibial tract receives two muscles. Tensor fascia lata and gluteus maximus. So gluteus maximus, and the third is on the tract. Then here is biceps femoris. After this, the front compartment, vastus lateralis, vastus medialis, intermedius, and then vastus medialis. Okay? When I was teaching you thigh, I told you there is a small muscle here, articularis genu. So these are the origin of articularis genu fibers. They must make it red. They make it blue. I don't know why. It's red. This is origin. This. So yes, it is not inserted on a bone. It is inserted into the capsule. Here is sorry. This is right and this is left. No problem. Here. So here is the capsule and here is a patella. Okay. So before patella, it will insert into the capsule so that when I flex or extend with the movement, it is not crushed with the patella. So it saves the direction of, this is the muscle called articularis genu. Articularis genu. Okay. Here is quadrate tubercle. I told you. Quadrate tubercle, quadratus femoris. Quadrate tubercle, quadratus femoris. Conical iliopsoas, iliacus and psoas. Here, piriformis. This one in between, piriformis. Here three muscles: gemella superior, gemella inferior, and obturator externus. Obturator internus inside the fossa. Remember, like inside internus. Yes. Here, iliacus and psoas, quadratus femoris, gluteus maximus, medius. Here three muscles, here one. Three, gemellus superior, gemellus inferior, obturator externus. And here inside the fossa, obturator internus. On the lower end, this is adductor magnus going here. And now probably you have done with the leg. There's a big gastrocnemius muscle with two heads. One here, one here. Yes, popliteal fossa. So here gastrocnemius and a small muscle plantaris. Going. Plantaris. I told you in the fossa yesterday that here is gastrocnemius and here gastrocnemius and plantaris both. Thank you very much. Any questions? I hope you understand. Not remember, understand. Yep, the father. Yep, what? Yep, the father.